Now let's see the scapular region. The scapular region, it is concerned with the back of the scapula, and this region, it includes so many muscles. So for the understanding of the scapular region, let's see these two real images. This is the back of the scapula along with the humerus, and this one is the anterior aspect of the scapula along with the humerus. Here in this figure, we can see that this structure, it is the spine of the scapula, and the spine of the scapula will divide the dorsal aspect of the scapula into one fossa above, and that fossa, it is called as a supraspinous fossa, and one fossa below, and that is called as a infraspinous fossa. And here on this humerus bone at the head of the humerus, this is the articular surface of the humerus, and here this is the greater tubercle of the humerus. Within the greater tubercle of the humerus, we appreciate three flattened impressions. One is the upper impression, one is the middle impression, and one is the lower impression. So let's see the muscles attach over the scapular region. One muscle that is going to arise from the supraspinous fossa, and this muscle is a small muscle, and this muscle getting origin from the medial two-third of the supraspinous fossa, and this muscle it forming a tendon which passes under the acromion process, and this tendon it is going to coming out from the this, and the tendon which is going to coming out just under the acromion process and going to insert over the upper impression of the greater tubercle of the humerus. So this muscle it is the supraspinous, and so this muscle it is the supraspinous muscle. The supraspinatus muscle, when we view from this anterior aspect, we can appreciate that this muscle it is going to passes from somewhere here and going to insert here, and this muscle it is separated from the acromion process by one bursa, and this bursa it is present somewhere here, and this bursa is called as the subacromion bursa. When the inflammation of the subacromion bursa is there, that is called as the subacromion bursitis. What should be the action of this supraspinatus muscle? When this supraspinatus muscle get contract, it will lead to the abduction of the humerus. But the abduction of the humerus, or we can say abduction of the shoulder joint, we can access by 3 degrees up to 0 to 15 degree, from 15 to 90 degree, and more than 90 degree. 0 to 15 degree abduction of the shoulder joint, it occurs due to the supraspinatus muscle. So the supraspinatus muscle, it is the abductor initiator. As this supraspinatus muscle, it is the abductor initiator. When the subacromion bursitis occur, the patient feel pain when we put our finger to the acromion process when the humerus is lying by the side of the body. But when the patient is asked to abduct the humerus, and the patient when abduct the shoulder joint, it will lead to the disappearance of this subacromion bursa under the acromion process, and that's why the pain disappears when we put this finger at the same point, and this sign it is called as the Doban's sign. So this is very important clinical sign concerned with the subacromion bursitis. Now let's see the second muscle. When we see the second muscle, which is going to arise from the medial two-thirds of the infraspinous fossa, somewhere from here, and this muscle passes upward and laterally and going to form the tendon, and this tendon it is going to insert at the middle impression of the greater tubercle of the humerus. And this muscle, as it is passes from the infraspinous fossa, this muscle it is called as the infraspinatus muscle. When we see the lateral border of the scapula, it is thickened border and having three parts. The part just below the glenoid cavity, this is called as the infraglenoid tubercle. From this infraglenoid tubercle, the long head of the triceps muscle is getting origin, and it is going to fuse with the other heads of the triceps muscle. Just below the origin of the long head of the triceps, we find the origin of one more muscle that is extended somewhere here, and this muscle it is called as the teres minor muscle. This teres minor muscle it is going to arise from the dorsal aspect of the lateral border of the scapula just below the infraglenoid tubercle up to the inferior angle, and this muscle it is going to form the tendon which passes upward and laterally just behind upward and laterally passing behind the triceps long head of the triceps muscle and going to form a tendon which is going to insert at the lower impression of the greater tubercle of the humerus. So this muscle it is called as the teres minor muscle. These muscles, the we can say the tendons of the supraspinatus, infraspinatus, and teres minor muscle, as they are going to approach toward the greater tubercle of the humerus, these tendons they are going to flatten and getting fused with the capsule of the shoulder joint while passing through it. Just below the teres minor muscle, we find one more muscle, and that muscle it is going to arise from the inferior angle of the scapula, somewhere from here, and this muscle it passes upward and laterally and passes in front of the long head of the triceps muscle, and it passes in front of the humerus also and going to insert on the medial lip of the bicipital groove, which is present on the anterior aspect of the humerus. So this muscle it is the teres major muscle. So here in this figure, the other figure, we can appreciate the anterior border. So here in this other figure, we can see that this is the bicipital groove which is present on the anterior aspect of the humerus, and three muscles are getting attached with it. One muscle that is the pectoralis major muscle which is going to insert on the lateral lip of the humerus, lateral lip of the bicipital groove. Teres major muscle it is going to insert on the medial lip of the bicipital groove, while the latissimus dorsi muscle it is going to insert within the floor of this bicipital groove. So a common mnemonics that is called as the lady between the two major, it can be helpful to understand the insertion of the bicipital groove. Uh, when we see the anterior aspect of the scapular region, we can find one more muscle, and that muscle it is going to arise from this subscapular fossa from its medial two-third part, and this muscle it is multipinnate muscle and going to arise from this medial two-third of the subscapular fossa, and it passes upward and laterally and going to form the tendon, and this tendon it is going to insert over this lesser tubercle which is present on the anterior aspect of the upper end of the humerus. So this muscle it is called as the subscapularis muscle. So we have learned so many muscles within the scapular region. Out of them, the muscles which are insert over the greater tubercle and the lesser tubercle of the humerus, they are going to enclose the shoulder region outside the capsule, and the tendon of these muscles they are going to blend with the capsule of the shoulder joint and gives additional protection to the shoulder joint, and that's why these four muscles, supraspinatus, which is going to insert over the upper impression of the greater tubercle, infraspinatus getting insert over the middle impression of the greater tubercle, teres minor which is going to insert over the lower impression of the greater tubercle of the humerus, and the subscapularis muscle going to insert over the lesser tubercle of the humerus. These four are collectively called the rotator cuff, or it is also called as musculotendinous cuff. This musculotendinous cuff or the rotator cuffs, it is going to strengthen the shoulder joint from outside the capsule of the shoulder joint and going to blend with the shoulder capsule, and that's why it is also called as the protector or the guardian of the shoulder joint. So now let's see the same muscles in one schematic figure. Here in this figure, we can appreciate the posterior aspect of the scapula. Here from the supraspinous fossa, we find this muscle, and this is the cut end of this same muscle, and this is the supraspinatus muscle. And here, this muscle, it is the infraspinatus muscle, and this is the cut end of this infraspinatus muscle. Just below it, we can see this greenish structure, and this greenish structure is the capsule of the shoulder joint, and just outside the capsule of the shoulder joint, this is the teres minor muscle which is getting insert over the lower impression of the greater tubercle, and this is the long head of triceps. This teres minor muscle it passes in front of the long head of the triceps, while this muscle it is the teres major muscle which is passes in front of the long head of the triceps femoris muscle. Now all these muscles they are going to form some triangular and one quadrangular areas, and the quadrangular area which is formed somewhere here between the surgical neck of the humerus on the lateral side, superiorly by the teres minor along with the capsule of the shoulder joint, and in front of the capsule of the shoulder joint we find the tendon of the subscapularis muscle. Below by the teres major muscle, and on the medial side we find the long head of the triceps muscle. So this quadrangular space it is the important space, and it is the intermuscular space between this scapular region muscles, and very important nerve that is called as the axillary nerve it passes through it, and this axillary nerve it is going to supply the teres minor muscle also. Along with the axillary nerve we find one posterior circumflex humeral vessels. One more space it is going to form somewhere here, and this space it is the upper triangular space which is going to form by the teres minor muscle above, teres major muscle below, and the long head of the triceps muscle on the lateral side, and this space it contains one vessels, and these vessels are the circumflex scapular vessels. This circumflex scapular vessel, this circumflex scapular artery is a branch of the subscapular artery, which is actually the branch of axillary artery. One more space is going to form at the lower area, and this is called as the lower triangular space. And this lower triangular space, it is going to be formed by the shaft of the humerus on the lateral side, the long head of the triceps on the medial side, and the teres major muscle above. And this triangular space, it carry one very important nerve of the brachial plexus, and that is the radial nerve, which is going to passes somewhere like this and passes under the triceps muscle. And along with it, we also find the profunda brachii artery, which is having the same course like that of the radial artery, which passes through the radial groove. This lower triangular space, it is also called as the triceps hiatus. Now let's see the nerve supply of these different muscles. First of all, let's see this ligament, and this ligament, it is going to bridging the scapular suprascapular notch, and this suprascapular notch, it is bridged by this transverse scapular ligament, and it will convert this notch into one foramen, and through this foramen the suprascapular nerve will passes, and it is going to supply the supraspinatus muscle, and after passing from the splenoglenoid notch, it is going to supply the infraspinatus muscle also. So this nerve, it is the suprascapular nerve, which is actually a branch from the upper trunk of the brachial plexus, having the root value of C5, C6. This teres minor muscle, as we already discussed, it is going to be supplied by the axillary nerve, which also having the root value of C5 and C6. And this teres major muscle, it is going to be supplied by lower subscapular nerve, which is actually the branch to the subscapularis muscle, which is actually the branch of the posterior cord of the brachial plexus. Now when we see the subscapularis muscle, it is going to be supplied by two nerves. One is the upper subscapular nerve and one is the lower subscapular nerve, and these subscapular nerves, they are the branches of the posterior cord of the brachial plexus. As we already discussed, this lower subscapular nerve also supply the teres major muscle. So we have seen very briefly the origin, insertion as well as the nerve supply of all this muscle. Now let's see the action of all these muscles. As we already discussed, these muscles are responsible for the protection of the shoulder joint. Along with it, the supraspinatus muscle, it is the abductor initiator. As we already discussed, it is responsible for the abduction of the shoulder joint from 0 to 15 degree only. So this is the only muscle of this rotator cuff which is not related with the rotation of the scapula, but it is only concerned with the abduction of the shoulder joint. while the infraspinatus muscle along with the teres minor muscle when get contract, it will lead to the lateral rotation of this shoulder joint, while the contraction of this teres major muscle as it is attached on the anterior aspect of the humerus somewhere here, and that's why it is responsible for the medial rotation of the shoulder joint. While the subscapularis muscle, as this muscle it get contracts, it is present and insert on the anterior aspect of the upper end of the humerus at the lesser trochanter. At the lesser tubercle, it is also responsible for the medial rotation of the shoulder joint. So this is all about the scapular region.